Now, one thing you probably already know is that if it sounds too good to be true, it probably is. We're talking about the set of ideas that Kamala Harris and Tim Walz would bring to the table if they were elected in November. Of course, finding what their policies are is sort of like looking for a contact lens that popped out of your eye on the street corner. Good luck finding it. Now, they both have records from previous campaigns, talking points from past interviews, and even how they've served. For Kamala Harris, it includes her grand idea to provide health care for all. I'm talking everybody, even the millions of people who are here illegally. Problem is, Medicare is already going broke. So imagine what happens if we add millions of people to the health care rolls that the government pays for. And by the way, don't forget that the government is you. You will be paying for it. Then consider what it might be like to get a doctor's appointment, or what would happen to your taxes if we do, in fact, pay for all that. There's just no example of that working anywhere in the world. But it sure does sound promising, doesn't it? Kind of like the college tuition loan forgiveness program. Rack up the debt, just like magic. Joe Biden and Kamala Harris will wave a sparkling wand and all that old debt goes away. Well, except for the fact that only half the country pays federal taxes, and the debt's already over $35 trillion. That's right, $1 trillion. And for those who do pay, 20, 30, 40, 50% or more is already taken out of each check they ever receive. Here's another one of those elephants in the room. Kamala Harris's support for the Green New Deal. It began by Joe Biden and Kamala Harris cutting off the Keystone Pipeline. They doubled down a couple of years later by setting a ridiculous standard for electric cars and how they had to be in everybody's hands, far before there's going to be enough charging stations or even power plants to fuel those electric cars. Maybe the green meant the money involved, because there's nothing green about what a tax on these cars will do to the environment of our pockets. We're joined now by Michael Leavitt, former HHS Secretary and former administrator of the EP under President George W. Bush. And he was a governor during the time when I served in Arkansas. He was Utah's governor from 1993 to 2003. Michael, it's great to see you. Welcome, and such a pleasure to get to visit with you today.
Mike, I'm so pleased to see you. I have great memories of our times together, and I look forward to a chance to visit.
Well, something that hasn't turned out quite as successfully has been trying to fund Medicare. It's not that the program is terrible. It is a lifesaver and a lifeline to many people, but it is very expensive. Kamala Harris says she'd like to have Medicare for all, that everyone would get health care, including people who are here illegally. Now, you ran that entire program as head of HHS. If we were to suddenly extend basically Medicare for all, not only to all the American citizens, whatever age group, but also to the maybe 20 million illegals, what would happen financially and to the healthcare system if we did that?
Well, there's no question that it would simply break our budget even more than it is now. We have a quite you mentioned on the opening of the show, $35 trillion debt. We're running deficits that are greater than $1 trillion a year. Medicare and the excess of our medical system is a great part of that. If you would add millions more people with the subsidies that are required for Medicare, it would just accelerate the point of the time when we would, as a country, no longer be economic leaders.
You always were an innovator, both as governor and as Secretary of Health and Human Services, looking for ways to take programs that we weren't going to get rid of, but make them better, make them sustainable. I know you tried diligently, both with Medicare and Medicaid, the program that the states run. But if somebody put you in charge and just said, Michael, whatever you want to do, you get to do it. Talk to us about what we should do and could do with both Medicare and Medicaid that might make those programs more sustainable.
Well, let's start on the side of what our individual responsibilities are. And the key here, I think, is that Americans do not live particularly healthy lifestyles. And so we all have a way in which we can contribute to this. We can live healthier lives. The system will work better. And that's an individual responsibility we can take on. I think another thing we can do is begin to look for what I'll refer to as overutilization. It's when we use health care services that are not needed or required. And we can begin to reward people in our system for both living healthier lifestyles, but also recognizing that they're participants in the economies of the healthcare system. We can begin to pay for healthcare differently. Rather than rewarding more and more procedures, we can begin to pay physicians and care providers on the basis of the value they bring. This is often referred to as value-based healthcare, and it's where we provide opportunities for physicians to be paid on the basis of keeping people healthy. Another very important component of this is recognizing that the system of care in our country requires a different type of organization.
You know, the economy is uncertain. You never know whether your money's worth as much today as it was yesterday. It's one of the reasons I buy gold from American Hartford Gold. American Hartford Gold has earned a 5-star rating and an A+ from the Better Business Bureau. Be sure to tell them Mike Huckabee sent you. They'll give you up to $15,000 of free silver on your first qualifying order. Call 844-417-1010 or text Mike to 998899. You'll be glad you did business with American Hartford Gold. Well, you've just mentioned some things that I'm listening to that. I'm thinking, well, that sounds pretty like common sense. Doesn't sound that complicated. I mean, it does require some heavy lifting on the part of both individuals and the government. So why aren't we getting there? And clearly we are not. So where are the points of resistance? Is it the medical community? Is it the individual? Is it Congress? State legislatures? Where are the big walls that make this hard?
Look, let's just acknowledge that this is 19% of the entire economy. This is a complex subject. And part of the dilemma is that one person's waste is another person's living. And so you have lots of different perspectives that are to be found on this problem. But a large part of it is recognizing that we, as a country, haven't got a sound economic formula to pay for it. There are some things about it that even as a Republican, I look at and say, maybe there's some inequities here in that my children are sometimes paying for to supplement my Medicare. Maybe I ought to recognize that I could pay a little more, and they could have lower taxes, and that they'd be more willing to do that. So I think there's some ways we can begin to make it more fair. But I think the primary thing is to get to the way in which we pay for health care. We pay for health care on what we refer to as a fee-for-service basis. And it means that medical providers who provide more procedures, for example, get paid more. And if we were to pay physicians and others on the basis of the value they bring, it's possible that even if we shared with them some of the money that we save by keeping people healthy, everyone would win. So going from a fee-for-service system that rewards volume, we could go to a system that rewards keeping people healthy, and the system would ultimately benefit from that.
It makes a lot of sense. It would mean that instead of going to the doctor 7 times and finally he gets it right and he gets 7 payments, he gets it right the first time and he gets a bonus for getting it right the first time. I think we can all see that there would be some value in that.